Welcome to the Odds Fitness Podcast. I'm Asad Hussain, the founder of Odds Fitness. We at Odds Fitness help individuals maximize their health span and also achieve their true fitness potential. With my formal education in exercise and sports sciences and also in lifestyle and wellness coaching, we bring to you the most data-driven insights from industry experts who specialize in the Asian and the Middle Eastern populations. These experts have significant experience considering our distinctly different variable factors such as genetics, phenotypes, cultural and environmental influences and habits. These factors contribute to the most common and consistent risk factors for lifestyle-related diseases and health and fitness challenges in South Asia and the Middle East. While there is a wealth of data and content available from the West, much of it becomes irrelevant when applied to our context, as the dynamics here are vastly different. So let us begin.
Today we have Dr. Arpit Bansal, who is a laparoscopic surgeon who specializes in cancer surgeries. He's also a gut expert, and he's also somebody who's fascinated with the whole idea of longevity. And of course, he's a nature lover. And we just wanted to invite him and pick his brain on what his ideas are about longevity, since he's practiced medicine for how many years?
15 years now.
For about 15 years now. He looks young. He's 38 years old. I like picking on young doctors' minds as well, because they have new ideas, they have fresh ideas, and they also, try and share the wisdom of the senior doctors that we have, and they're also learning new age sciences as well. So, Dr. Arpit Bansal, welcome to the Odds Fitness Podcast.
Thank you so much. It's just so nice of you to invite me here.
Right. So, just to put things into context, can you explain to our audience what a laparoscopic surgery is as compared to a regular surgery?
So laparoscopic surgery, is just a very traditional question. Laparoscopic surgery is like some kinds of robots or some kinds of arms which are like pencils. Imagine like how you are holding a pen. So just such even thinner instruments than those going through our areas of our stomach and handling everything, the smaller, finer tissues inside.
Right.
So it's like very similar to the robotic surgery, which is now upcoming. But the only thing is that even the micro fine tremors of the surgeon can be unlimited by the robot.
Right.
But what exactly we do in laparoscopy surgery is exactly the same which an open surgeon does. But what is the main differences? So open surgery, for example, a very common surgery is gallbladder. Like in North India, gallbladder has lots of stones. So the easiest and the traditional gold standard all over the world is to remove the gallbladder.
Right.
Because it is an extra organ and it will not hinder the bile formation, which ultimately happens in the liver.
Yeah.
So the standard surgery safest is to remove the gallbladder. So in old days, it was used to be a big incision under your flank and on your right side, and big incision, painful surgery, 15-20 days recovery time, 1 month easily bed rest. Post that also you'll have a big scar on your stomach. So then a laparoscopy surgery, what it does is like just from 3 less than a 5 millimeter instruments, one maybe a 1 centimeter, because the camera port is a slightly higher, stronger one. So one camera port will go through your umbilicus. That scar will disappear after a week, and 2 or 3 5 millimeter more instruments, as I told you, like pen standard, and will go inside, will meticulously take off the gallbladder. What benefits to the surgeon is it is a very comfortable surgery, I should say. I love doing laparoscopy because it is not taxing on me. It is like, you can say it's like playing a video game. But obviously it is, there are lives at stake, especially when I'm doing a laparoscopic cancer surgery. But ultimately it is a very meticulous surgery. What we do in open surgery, we do it with our fingers, feel that organ. Sometimes we need that feeling. But ultimately it is a lengthy surgery. It is a more invasive surgery. We are invading to the muscles, how much muscles we are damaging in the way. In this, it's just like a needle prick. So you can take a blood sample and you can start doing boxing immediately after 5 minutes of it.
Right.
So that's what the minimum invasiveness it causes. That's why the patients after laparoscopy go home within 24 hours, no pain, hardly any pain, and the organ is out.
Right. Amazing. Wow. So, I've had an arthroscopic surgery myself for my anterior inferior labral tear, which is in regular context shoulder dislocation. So I know what you're talking about. The other surgery that would have happened would have been a latarjet, where it would have been way more
invasive and
Yeah.
more recovery time needed.
Yeah, for sure. It was twice the recovery. I recovered quite soon from it, so I understand and I value what you're
And
talking about.
now the thing is, the benefits of laparoscopy now has been gone into even cancer. So, for example, uterine cancer surgery, or maybe a gallbladder cancer surgery. Gallbladder, let's not talk because it's a very risky cancer and a very poor prognosis. But uterine cancer is one of the most common cancers for women, and it can be safely done laparoscopically, and the patient goes home within like 2 days. Sorry,
Right.
48 hours. So what happens is, then the patient, for as you might be aware, that for cancer there are lots of therapies, lots of treatment requiring apart from surgery. For cancer, surgery is not the only treatment.
Yeah.
You need chemotherapy in some cases, you need immunotherapy in some cases, you need radiotherapy in some cases. So if you are that doing a laparoscopic surgery, patient is fit and ready for any other adjuvant therapy within a week. And contrary to an open surgery, the open wound will take sometimes 3 weeks, 4 weeks to heal, and then it will delay the chemotherapy, ultimately delaying the treatment.
Right.
Correct.
Amazing how science has come along. Okay, so could you name a couple of common lifestyle diseases where you've seen patients could have had better lifestyle and prevented some of those surgery situations for themselves?
See, ultimately, the chronic diseases, the lifestyle diseases are only 4, which is the heart disease, the cardiovascular picture, which everybody is aware of, the atherosclerosis blocking our arteries. Then it comes to the neurodegenerative disease, the Alzheimer's. Then it is the diabetes,
Alzheimer's, dementia.
Right. Parkinsonism, everything.
Right.
And then it is the metabolic diseases like the diabetes, which is
PCOS.
CCOS. All these metabolic, this is a metabolic syndrome. It's not just diabetes, hypertension, thyroid, everything is nailed down to the same thing.
Right. Having said that, still, like let's say you're talking about gallbladder or something like that. When you look at a patient, do you go like, okay, you know what, if you would have not done any of these things, which, like you mentioned, the 5, I would say 6. 6 would be exercise, nutrition, sleep. You would also have social connections and also avoiding risky substances and things like that.
All these lifestyle diseases, for example, if you're talking about the gallbladder, you're consuming food or fat or other foods which are not healthy for your gut. And everybody's gut is different. So I may be eating lots of junk food. I may not get any diseases, specifically gallbladder or pancreas or any of these metabolic syndromes. But other person's gut is entirely different. So like milk suits for somebody's, milk doesn't suit. So it's all nails down to what you're consuming as per your gut. So to tell any dietitian or any person who's recommending any diet, it's the concept of generalized diet may work in more than 50% of the people also. But it's not the right concept. It's ultimately guesswork.
Right.
X amount of protein, which we'll talk, is very essential. X amount of carbohydrate, bad saturated fats is not. That's the generalized picture we can. But ultimately, we all know we need everything. We need fats also. We need to maintain the balance, and plus we need the micronutrients, the macronutrients, which we hardly talk about. Vitamin D in the right substance is so much important. So all these things ultimately contribute to the lifestyle diseases, which ultimately contributed to all essential surgical diseases, except cancers is all directly linked to it, except traumas.
Right.
So then that is a different thing. Acute infection is also a different thing.
Right.
Everything, every surgery which ultimately we are doing is directly linked to our metabolic syndromes, to our lifestyle diseases, to our lifestyle. So we need to be following all 5 pillars of longevity or health to avoid all these diseases. But ultimately, what happens is people say that I didn't smoke, I didn't drink alcohol, I used to exercise, I used to sleep properly, but still I got cancer. Many people, you have heard this is a very common story.
It's luck.
Let's not talk about luck. The destiny is definitely one part of it. But I think most of us ignore or are not really aware of our bodies.
Yeah.
So,
because I think many people also don't know, are not that self-aware, and also they don't have any way to measure certain things.
exactly. Like I'm wearing these rings, obviously the Apple Watch, but I work out. I've started working out with the Morpheus heart rate monitor also now to specifically train on zone 2. So these are things which people might think that I'm overboard, I'm going extreme. But I think we have to use technology these days to objectify, as you were saying, and obviously not get too into it so that it plays on your mentality. You have to have that balance.
Will it happen to you?
It definitely has.
So if you don't have your water bottle, which is not a plastic bottle, or if you don't have one of your monitors on and you started.
I have worked on it and I've come out of it.
Right.
Because there was days when I read the Matthew Walker's book, Why We Sleep.
Right.
I became so into sleep that every morning I used to first get up and look at my sleep score on my Ultra Human ring that time. So and the days there was sometimes the ring got glitchy. So and they didn't record proper sleep. So these things obviously is very important for your emotional, the fifth pillar, the emotional or the psychological health.
Right.
So you should not play on your mind, but you at the same time, ignorance is not bliss. We cannot go by ignorance is bliss, that I don't want to measure all of these, whatever is going on. Many people have this approach in life that if sab acha to chal raha hai, I'm eating right, I'm working out, so why objectify and get complications? But I think it is very important to objectify if you have that mentality and personality to maintain it in the balance.
Right. I've done a little bit of research on my, we know all the right things to do, etc., all of that. And then I came upon this one person making a bold statement saying that, you can't really, you see all the nutritionists, you see all the health experts in this world, but they have very average lifespans. And if that was the best way to live a long life, then maybe they would have done it for themselves, right? And you'll see all these octogenarians, centenarians, all these people. They're not necessarily, focusing on measuring their sleep.
Definitely.
We have stressed upon lifespan and health span,
Correct.
right? And one very important thing that people miss out on is that, of course, we're looking at lifespan. We'll see that, okay, Warren Buffett has his burgers and Coke and still lives very long. Having said that, I have seen myself more active, more independent, maybe somebody who doesn't have a kyphosis like frail structure at that age as well. And that makes a huge difference.
Definitely.
I think it determines the quality of your life. And when we are discussing the four horsemen of Peter Attia, I think the worst of those would be, from my opinion, the neurological diseases. The reason for that for me would be that you lead a life with purpose and you craft this entire story behind yourself. And that's the kind of, we are narrative beings. We need narratives around us.
Very interesting perspective that you feel that the neurodegenerative disorder is the most cruel of the four horsemen.
Correct.
It is definitely.
And I was just sharing my perspective because if I'm
Very interesting perspective.
Yeah, because if I'm XYZ individual, right, I want to go out as XYZ individual.
Yeah.
I want to go out in a way where I'm remembered as XYZ individual and not somebody who's having difficulty in remembering, coping with day-to-day activities.
That's very horrifying to think about.
Correct.
Actually.
Correct. So, when we talk about neurological diseases in India, I talk about them as novelty diseases where, you would only reach that stage when you have escaped cardiovascular disease, escaped cancer, escaped diabetes or something like that. And then if you're having that, you're most likely living a long life.
That's a very interesting perspective though.
Right.
But I don't feel, it is a good angle, but I don't think that you reach to the neurodegenerative horseman, the fourth horseman, when you have escaped all these three.
Yeah, sort of. Yeah, you're right, actually.
Because actually what happens is in India and in generally,
Yeah.
We used to live at a lifespan of 50, 60, 70. So now as our health span and our lifespan are increasing.
We're still 72 or 73.
Exactly, but as it is increasing because of new technologies, you are diagnosing heart disease much earlier. There are lots of angios, lots of intervention cardiology things happening.
And medical facilities being largely available.
So the lifespan will increase and all these four horsemen will increase. It's not just neurodegenerative.
Right.
Probably you are in that mindset right now and you are telling, that's very interesting and very, very, I think it's difficult to label that which of these four is the most cruel.
Right.
But I think if I would want to label one of them, it will be heart disease and atherosclerosis.
Because we all know that many men, and it's, but don't you think it's easily avoidable? Like if you get, because I tell all my clients / people who I work with, I tell them, get a CT angiogram done every 5 years.
Yeah, that should happen.
Right.
But interestingly, so obesity and diabetes, as you know, is like linked. It's metabolic. Ultimately, it all nailed down to insulin resistance. So the thing is, as per the medicine traditional, if you talk, follow any guidelines, American guidelines, Indian guidelines, a person is labeled a diabetic if his HbA1c, the glycosylated hemoglobin, is above 6.5. Correct? Above 6.5.
But you would be if you're 6, you're still diabetic.
No, but what I'm telling you, American guidelines of treating diabetes.
Right.
If it is less than 6.5, then you are labeled pre-diabetic. But you are not labeled diabetic. And what is the treatment for pre-diabetic? Is mild exercise, watch your diet, and may require sometimes some prefers metformin is an anti-aging drug also, not just a glucose lowering drug. So metformin
It's not FDA approved for anti-aging yet.
in US it is, in India it is
Is it
not.
FDA
It is,
approved?
sometimes, yeah, in some under some conditions it is approved. Not for aging, but definitely for diabetes.
For diabetes it is. For anti-aging
is
it's not
it's
yet.
not FDA approved.
Right.
So I'm saying for a pre-diabetic of HbA1c less than 6, maybe 6.4, which is not 6.5, he'll be advised mild exercise, he'll be exercised maybe metformin or a diet control and an annual monitoring, and we'll wait and watch. So that's not the right approach. Why are we waiting? And we have to have extensive, ideally a person's should a gut microbiome test is essential. But it is studying the vast diversity of bacteria which is there in your body. For example, I got it done on myself. So I have 5,000 different species of bacteria. And we were coming down to the epigenetics again.
Right.
But let's focus on this gut microbiome first. So if you understand what and new technologies, for example, right, we used to only do fastings and HbA1c to diagnose a diabetic.
Right.
But now continuous glucose monitoring is so essential. And I have worn the Ultra Human for quite a while, and I keep doing it. But I'm not a diabetic. I do it for my athletic performance, and so that I know some foods might cause a glucose spike in me. Some foods might not cause a glucose spike in. For example, potato starch. For example, black coffee. Some people, even black coffee causes a lot of spike. So
Right.
you need to understand specifically, and probiotics, all these things for gut health is so generalized in the traditional medicine industry, which cannot happen, because it has to be. For example, I have 5,000 species of bacteria. Most of them are good, some are bad. So we need to try and eliminate through diet, not with antibiotics, the bad ones, and we need to add the diversity of the good ones. So probiotics में सब का answer क्या होता है कि you should include dahi in your diet. Do you think that including just dahi in your diet will fetch
Of
you?
course not, because you need to add a host of prebiotics and other sources of
Correct.
things which the bacteria is going to thrive on. Just putting somebody in a populated
Also,
space, if you don't give them housing, if you don't give them
Definitely.
clothing, if you don't give them an environment to thrive in, the bacteria is not going to grow.
So prebiotics is the bacteria, but
Mm.
probiotics is the bacteria. The prebiotics is the fiber.
Yeah.
That is, you're absolutely right. But we should also try and increase the biodiversity.
Right.
Like, for example, having different kombuchas, having kimchis, having different chutneys. Speaking from a traditional Indian Ayurvedic diet, like अभी तिल का सीजन है तो तिल की चटनी, आमले का सीजन है तो आमले की चटनी, करौंजे का सीजन है तो करौंजे की चटनी. मतलब these all things have different species of bacteria which can be very, very essential and ultimately prevent diabetes.
Right.
Not just prevent, treat diabetes. So I think medicine 2.0, as Peter Attia clearly says, that medicine 3.0, we have to do if you have a diabetes, for example, this is not the answer that you will have the diabetes medicine, theek hai, lifestyle theek kar lo, control, but still keep having the medicine all your life.
Something like diabetes is very easily preventable if you exercise and eat correctly. And when I say correctly, you don't have to necessarily give up on things completely. You have to
Very
be
true, very true.
sensible about the way you may be just a little aware about how you're eating. And I've personally seen it, gone through a study where without any medication, without any let's say lifestyle nutrition intervention, if you just did strength training 3 days a week, 60 minutes, right, it would reduce your HbA1c by 1.3%.
What happens really when you're doing
Yeah,
this, you're increasing your metabolic flexibility. So
there's a host of things that happen. If you have increased muscle mass, more glucose up there, more glycogenolysis, host of things that happen.
But ultimately,
GLUT4 comes up.
So your metabolic health is determined by your mitochondria health.
Yeah.
And your mitochondria health your mitochondria is the place where you can use two fuels as energy, fat and glucose, especially if you're working out. So an athlete who's a fit person like maybe you or me, we might, when we are doing a marathon maybe, or working out strenuously, we have the metabolic flexibility to use both glucose and fat as fuels,
Right.
and not build up the lactate so that no crampings and no damages happen, to avoid injuries, obviously. But a person who's relatively not fit, or probably a little chubby person who needs to lose the fat, he'll be metabolically inflexible and he'll be only using glucose.
When you say chubby, what do you, because I've seen athletes who are chubby. They have great metabolic
So
flexibility.
ultimately, you have to keep cutting down your. You are a more expert in fitness industry. So
Right.
you tell me.
So I would say that you could mainly narrow down fat stores. And if I were to classify somebody as somebody who's metabolically poor, it would be somebody who has more visceral fat.
Good.
Because of a host of different reasons. Because you would be in a constant state of inflammation. When you'll be in inflammation, it will have a downward
Inflammation
cascade.
is aging.
Yeah.
Aging.
Yeah. So
That's-
it's going to have a cascade of effects.
Yeah.
And of course, on its own also, it's going to disrupt the way your organs are going to function, because
Absolutely.
it's around your organs,
Mm.
right? It's going to be part of your liver. It's going to be part of almost everything around that, right? So, and that's what leads to so many other diseases, hypertension,
Everything.
stroke, etc.
Linking it to the last question which you asked me initially, laparoscopy surgery, how often do you see with lifestyle diseases affecting it? So, like laparoscopic cholecystectomy is a very common surgery for any laparoscopic surgeon.
Yeah.
Apart from cancers and difficult surgery, this is a very bread and butter, simple surgery. So, hardly, like if I operate 10 gallbladders, for example, in the last week, hardly do I get to see the normal, fully normal liver.
Yeah.
Most of them have fatty deposits. You don't see the glistening blue color of the liver because of all these visceral fats and
Right.
all the fat deposits. And ultimately, it is the metabolic disease.
Could you correlate that to the diseases that they're having?
Lot of them.
Right.
And that is what is medicine 3.0 actually,
Right.
which we are again and again highlighting, that we need to understand the person more than, for example, a person who had diabetes, who has maybe he did an angio and he had little bit plaques in the arteries. Not enough to do a bypass or any intervention is required, but maybe 10 to 20%.
Right.
So then at that time, you have to be very, very alarmed. And you just, drugs like statins will not just help. At some stage, obviously, you may need to prescribe statins, but you need to get to the root cause of it.
Right.
And again, gut health, hydration is so crucial. Hydration is so essential. Then exercise and specific exercises. So with exercise, there is a lot of dilemma. Many people who are starting exercise, they do whether should I do more of strength training, should I do more of cardio. So what do you think?
I think if you exercise like somebody who wants to become a bodybuilder, it's not anti-aging. If you practice it, of course. If you exercise because you are a marathon runner, it still doesn't do the whole longevity thing. In fact, there is data to show that people who did just strength training, whether it was respiratory illnesses, whether it was cancer, or whether it was cardiovascular disease, they showed some decrease from sedentary individuals. If you would go to just cardio-based interventions, it would show a slightly higher increase, but the maximum increase would happen if you're doing both together. And this is something that we face as a problem as, lifestyle and wellness coaches in the fitness space as well. You meet individuals who are biased towards one form.
More of cardio or more of weight. Or
Yeah, they would be biased because I've seen it. And also there is data to support it, or literature to support it, that when you look at healthcare providers, even in elderly populations or physiotherapists, if you are somebody who practices in strength training, you are most likely going to advocate just that.
Correct.
If you're somebody who practices just cardiovascular,
That's not the right approach.
that's not right. So we try at Odds Fitness, what we try to do is we try and broaden the horizon. That's why we have individuals such as you, so that our trainers and our audience and our clients also know the importance of a holistic
Correct.
approach towards your life.
Why do you want to be fit, or why do you want to live long? So the ultimate aim is that the last 10 years of your decade, maybe if you're not very optimistic, you're planning to target, maybe think about 80 years. But if you're targeting 100 or any number you decide, the last 10 years of your life, you need to, everybody who's into getting into the fitness or just thinking about their own health span, needs to literally write down 10 things which they want to be doing in the last 10 years of their life.
Yeah.
And then you can understand the real journey.
That's in Atiya's book.
That's an Atiya's.
Yeah. That's how he does it.
And so, for example, a 80-year-old person, if he wants to be climbing a stair without breathing heavily, then at that time, even if his VO2
Or
max,
even climbing a stair.
even just climbing a stair,
Right.
so his VO2 max, if he wants to plan of doing that at the age of 80, then at 40, if he's 40 right now, he has to train his VO2 max very high. It's like same as the banking investment. We invest in our future.
Right.
So our building our muscle strength and mass, not just strength or mass. Strength and mass is like investing into our future.
Right.
Because as soon as we turn 40, if not 35, our muscle and our bone strength
Right.
decline rapidly. And same goes with our VO2 max. Everything declines
And power.
rapidly.
Power
And
goes down this
so
more.
power and tire is strength and
I wouldn't say the strength and power are same.
similar. Means
So work done upon time would be power.
definitely.
But our ability to generate that force, it doesn't decline as fast as how your power goes down.
Definitely.
So when we look at individuals and we try and tell them how they're aging, and I've been with people over a decade and stuff. I'm somebody who is measuring power for them, and I do that as a marker and a very crucial health marker. That if you're going down in power,
You measure VO2 max also.
of course, but we use a sub-maximal test. We don't use a maximal test because our population is usually 40-year-olds, 50-year-olds.
Okay. These days, see, rings are also measuring VO2 max, but none of them
They're not
technology are accurate as
They're not accurate, but we use a Douglas bag. I don't know if you know of it.
yeah.
And we try and assess a VO2 max from that if a client is open to it. If not, then we use a sub-maximal test.
Uncomfortable test.
It is a very uncomfortable test.
So actually VO2 max, the more important than the number. Number is definitely important, but more important than number is the trend, is the how your graph goes. So it is like investment in your future. Like if you build your muscle strength and your endurance strength, and you have done both kinds of training, as we discussed, the endurance is the zone 2 training,
Right.
which also you must be aware of.
Yeah, of course.
So how do you balance your clients with between zone
We
2
try
and
and we try and get them 150 minutes of zone 2, and we have
A week.
seen upward trends of VO2 max because they come from very average, let's say, like
Imagine if zone 2 training is increasing their VO2 max, then
Yeah.
specific VO2 max
Max
training will
training can-
do better.
how do you measure your VO2 max?
So I have very crucially want to do it in a lab properly, but right now I'm just estimating numbers through.
There's a lab in Delhi if you want.
I know I called Dr. Rana, na? I think.
I think so.
I called him. Tomorrow morning I wanted to stay over and do my VO2 max.
Must do it.
But he's not. He got his knee surgery on him, so he's not available.
Okay. I did mine back in university. I was way above average. I've always been an athlete. Having said that, doing a maximal VO2 max test, because we have, I don't know if you know, we have Dr. Dang, who's, somebody who's excellent in lab tests, etc., all of that, one of the bigger brands in Delhi. So we try and analyze who's at a risk, who's at a cardiovascular risk. We try our best to, navigate those waters. And I've heard of situations where people have had cardiac arrests during workouts. Right.
Yeah.
And we don't want any of that happening.
So very interesting. I was about to ask you this question only. So for example, I ran a marathon recently, a self did marathon, like me and my friend. But I'm training to run another event marathon on 24th November.
Right.
So I yesterday only, it was a Sunday, so I did a half marathon with my friend, my partner. So and I was reading a lot. So I have all the facilities. I have my own hospital. So I did my own blood lactate level post the run.
Right.
Just to understand how my body is reacting. So my blood lactate levels came actually very good. It was on the higher range, obviously post run, but it was within the range. So it was just 0.8.
Yeah. So
which is very, very good.
Which is good.
Yeah. Do you do these kinds of tests?
We do. Yeah. We do lactate tests because that's a very easy way to tell how metabolically flexible you are.
Well, correct.
Right. And if you do a lactate test,
how healthy your mitochondria is.
Exactly. And if you're able to get that nice dip and swing when you graph it over a couple of minutes, we do a lactate test, but not many people are comfortable with a prick. But if somebody wants the optimal longevity solution.
Obviously.
So then we get into all of those details and with all the
But
hypnosis
how
stuff.
open are like Indian clients?
Very,
very less.
very less, because they don't like being pricked.
Invasive. And
Huh.
But I think if you're getting into extreme fitness, which I think ideally everybody should get into, if you're talking about health, longevity, already Peter Attia clearly mentioned that we talk about supplements, we talk about nutrition, but exercise is the only longevity drug,
Right.
which is like the safest and has no questions.
It is the most effective.
most effective.
It's not even a question about being the safest. It is the most effective.
And
And I've heard people say that, these things are happening every day. Somebody is dying on a treadmill. Somebody did this.
if you are not aware about specifically your hydration and nutrition,
Not only that,
Huh.
but the fact is that to be able to reach to that point where you are having a cardiac arrest,
correct.
it's not as if it's happened suddenly. You are not aware of your body.
And in cancer, you're like very illogically not aware, and here you are hyperactive, but still you are not aware of.
Exactly. I've also seen individuals who have exercised regularly throughout their lives and they have experienced some sort of unfortunate cardiac event. And if I were to go and analyze, they're not focusing on their sleep. They don't have nocturnal.
important.
They don't have nocturnal dipping. They don't
So
have.
important.
Yeah.
Sleep and body temperature, and the sleep is so.
And your heart.
Sleep is not just food for your gut. Sleep is food for your immunity. Sleep is food for your brain. Sleep is food for very important time for the liver to detoxify. So ultimately, why do we get cancers?
Right.
Because we don't. Our DNA repair mechanism fails. We have oncogenes. Everybody has oncogenes, and we have all the repair mechanisms for anti-aging. Also, we have. You must have heard about sirtuins and all those things.
Yeah.
So if our repair mechanisms work optimally, then we will not get cancer.
Right.
And sleep is a very important part to allow the time to do that recovery every day. And data suggests that 1 to 2 hours of sleep deprivation is directly linked to causing cancer and
Yeah.
all these metabolic diseases.
Shift workers are highly prone to cancers. That study was there.
Night owl also.
Yeah.
So night owl is a different thing, but I think going with the circadian clock. So what happens when we as humans we landed on Earth? We were initially hunter gatherers. We all are aware of. We used to get up with sunrise. So our suprachiasmatic nucleus used to fix the circadian rhythm perfectly. There is a suprachiasmatic nucleus in our brain which fixes your clock for that day. So with our Neanderthals and when we were hunter gatherers, we used to get up at sunrise. We used to move for food. We used to hunt or maybe vegetarian, whatever, but you used to walk kilometers and kilometers every single day. That was a normal work. And there was no need for exercise. We invented exercise after we invented Zomato and Swiggy or other. We made our life comfortable.
Right.
So then we had to invent exercise to burn the calories.
Right.
But ultimately, movement was a natural part of our body.
Right.
And one more important thing was in that we used to carry we used to kill in herds and we used to carry those heavy things. So carrying is a speciality of human species which we have completely ignored.
Right.
We have made comfortable. Who wants to carry a heavy suitcase or heavy bag? Everybody has now someone to help them with it. So movement was a natural part of it. And then again in the evening, we used to eat, and as soon as we used to see the sunset, we used to go to sleep.
Right.
There was no intention. Then we developed light. Thomas Edison invented the bulb. And then the light revolution came. Then we started partying in night. So then all the hormonal cycles, which we were talking about, the lifestyle diseases, all the hormonal, the melatonin, the serotonin, everything got disrupted because of partying at night, because we are screwing with, and obviously add the alcohol, the smoking and all those toxins, which ultimately led to all the downfall.
Right.
We have done this.
We've had alcohol for a while, but there's a lot of things that we have messed up for ourselves. I think a very important aspect that we have messed up for ourselves is having positive social connections and stress resilience.
Very true.
And we do focus on the exercise and the nutrition aspect of it.
Most people do try to.
Yeah, they try to. At least they're aware of it, but they're definitely not aware of stress resilience. And also sleep has started to catch on.
Sleep has started to catch on. The sleep is the third pillar, and the fourth pillar to manage the stress resilience and to better your HRV, the heart rate variability, which we were talking initially also, is ultimately meditation. But what happens is when we utter the word meditation, so many people's mind they switch off. कि मेरे से तो होता नहीं है meditation, ये नहीं होता. So in that I have delved deeply to try to put the same thing in a different way. For scientifically speaking, it is called non-sleep deep rest.
Right. Of
है ना? So because they say ये तो फिर normal ज्ञान बांट रहे हैं. So blue mind is which I've been following. And interestingly, it is very, very. So I'm a scuba diver also. I'm a PADI certified scuba diver. I've purchased on small scuba tank, which I keep in my home in Allahabad. And one of my friends' swimming pool, I keep it. So I go into the pool and I meditate inside the water with my small scuba tank in my back. And it has air of 20-25 minutes. So I've been working on my breathing capacity. I pulled it to up to 35 minutes. So I meditate under the water. That is one way to collect to your blue mind. But what does blue mind means? So blue mind is a term determined by Wallace Nicholas, who's a marine biologist actually. And he says that blue mind is a state of mildly meditative state, which is a state of calmness, peacefulness, a sense of well-being, and it happens naturally when we are around water, near water, in water, or underwater.
Right.
But one of the crucial things which Blue Mind taught me was something called as, so we all know that we are relaxing around water, right? For example, a family takes a vacation near the water, a mother, father, and two children.
Right.
So everybody has a different, some people are feared about water. So that fear about water is due to some past life trauma or this present life trauma or childhood trauma.
Or maybe lack of exposure.
Maybe lack of exposure, because naturally we all are water babies. There is no exception. Every person, human being in this planet, spends first 9 months in his life in his mother's womb, which is breathing through water. Amniotic fluid is 80% water.
Right.
Your brain is 80%, 90% water. So ultimately, our connection to water goes way deep. And the blue mind ultimately, for example, we go on we were talking about a couple or a family goes on a family vacation.
Right.
So somebody wants to just chill in the water, swim in the water. Somebody wants to just read next to the water. Somebody would just want to close their eyes and just listen to the waves, sounds. So everybody has a different way to relax near the water. But
Right.
we all strongly believe that we are relaxing,
Right.
right? But now a very interesting thing happens. Science finds out that during this time, when we think that we are relaxing or resting, our hippocampus is the most active. And our brains consume the maximum amount of glucose at that time.
Wow.
And our brains consume the maximum amount of oxygen also at that time.
I didn't know that.
This is really true. And why? Because the hippocampus is the memory learning center of our brain.
Right.
It's the center of our brain which forms the core memories.
Right.
For example, we had this conversation, a lovely interaction. I also learned a lot of things. You also learned some things. And we are good atmosphere. Or for example, we go to any course or thing. And if we don't... maybe you have seen the book, small movie Inside Out, jo bachcho ki
Yeah. Very good movie.
Very good movie, talks about emotions,
Amazing movie.
the core memories.
Yeah.
So if you don't think, go to this default brain network state, which is done in sleep, to meditation and other ways, then you don't make this into a core memory. This will just become a superficial part of your memory and it won't impact your life.
Right.
This is a very important concept. So what is default brain network? Is the same phase when we are in unison with the universe. We are in our zone. It is same state which children or people achieve in daydreaming. When you are not doing anything and when you are sitting in a course and somebody taps you from behind, that person is in zoned out state. It's not a bad state to have. Actually, I recommend, as per the book and a lot of knowledge, that everybody should be daydreaming every day. Forget about meditation. It's the same level of benefit which you achieve at a parasympathetic level, because you are ultimately managing your parasympathetic, and with just doing workouts we are only activating our sympathetic system.
Of course. And anything, work or engagement with anything, social media.
In our life we need to activate our blue mind even more, because we are in a constant state of red mind. There is something called as the red mind, which is the stress mind,
Right.
or the cortisol mind, or the sympathetic system.
Right.
So as soon as from getting up in the morning, we look at our WhatsApp, we look at some random video, all those red minds started firing. Then we think कि बच्चों को स्कूल छोड़ना है या काम पे जाना है, वर्कआउट करना है, ये करना है. So we are constant in a task-based zone. We are already thinking. Many people are productive, many people are not productive, but they are still thinking too much. So they are continuously in the task-based zone.
Right.
So that has to be balanced with some time with connecting with the blue mind. And again, I say that blue mind is not just around water. It is the most natural. Everybody says, गुस्सा आया, पानी पी लो, ठंडा पानी पी लो. गुस्सा आया, have a shower. Everybody says that also.
Right.
And so wash your face with water. Ultimately, this nails down to the same thing. But ultimately, when this happens, so you need to balance it. There is water in each and every cell of it. If you
Could you-
just be aware,
Could you say that spending time with yourself in simple context
is
could be one of those things?
is blue mind.
Or maybe listening to music.
Anything.
I get zoned out when I'm exercising and with music.
So I get zoned out even doing laparoscopic surgery.
Right.
So
I hope in a good way, of course.
I'll hear you pointed at this beautifully out. So I'll tell you what zoned out is again in through the Blue Mind book only.
Right.
There are how do you achieve flow in life? As you said, you get enjoy during your workouts. So why? Because you get flow in life. You get to flow in life. Everybody
So,
wants to get
yeah.
flow in life.
So on that aspect of flow,
Hmm.
my understanding of what flow would be is A, you have certain demands,
Hmm.
and B, you would have, let's say, the amount of resources that you have to match those demands.
Perfect.
And whatever happens in the middle
Hmm.
is flow. So if you don't have adequate resources to match those demands,
true.
you would be stressed. And if you have too much resource and you don't have adequate demand, it would lead to boredom, right? So you have to be in a state of flow,
Very true.
right? And I tell this to a lot of young individuals that I work with who have this doomsday prophecy about themselves that will I be ever that good? Happens to a lot of third generation, second generation boys who come from wealthy families, have contributory effects around themselves, right? And when they're not able to do that, they need to understand that, if they're not able to either reach that level of demand that is being placed upon themselves, they need to take time out, work on their skills, or for that matter, either spend time with yourselves, because when you're spending time with yourselves, you're also trying to anticipate and understand what more can you do to enhance your skills or access those resources.
Very true.
Right? So, I have my best ideas when I'm in the gym, I'm exercising.
Good.
And in fact, I see myself, making notes of things when I'm in flow.
In this book, he described the 4 phases of flow very beautifully. You will understand it you have actually grasped the same thing.
Right.
I'm just putting it in a different words.
Right.
Number 1, you have to be doing something which you love, which is you also said.
Yeah.
Number 2, you have to have mastered the skill in the past to be doing it at a subconscious level, like walking. You don't think about walking. So I don't think about doing a laparoscopic surgery. It happens naturally. You don't think about gymming. So number 1, you have to be doing something which you love. Number 2, you have to have mastered the skill to do it meticulously and subconsciously. Number 3, there has to be a challenge, which you said. For example, I was a runner. I am a runner, so yesterday doing a half marathon seemed like a challenge. For example, a surfer who's surfing, the biggest wave will bring out the best in himself. So when you achieve this, when you do the third thing, there is a challenge. Then you attain the fourth and the most beautiful phase of flow, that is loss of sense of passage of time in whatever thing.
And every individual, I think, when I try to work with someone, when anybody from our company tries to work with someone, we try and identify their strengths. And we try and use those strengths to help them achieve a state of flow.
So true.
And I think, since you mentioned neuroplasticity, coming to this whole idea of stress resilience and having positive social connections, I think they play a huge role
Definitely
in your overall well-being and longevity. I've seen people who are bad with nutrition, bad with exercise, would also be bad with stress, would also be bad with sleep, would also be bad with...
But with good social connections, they live healthy and long.
Yes.
I agree.
So
but ultimately, that's not the right way to do it.
It's not the right way.
Partying and killing.
No, it would not be. But when you have right social connections, when you have positive social connections, you will very soon find yourself having the urge or the desire to live.
Definitely.
And when you have the urge and desire to live, that's when you'll automatically pay attention to exercise, nutrition,
Very true.
and sleep. Since you've read Peter Attia's book, would you like to tell our audience about exercise and brain health? Because I think a lot of people think that exercise is just for, maybe
too important. I cannot.
Correct.
I cannot, not less mention the stress about it.
Yeah.
Exercise is
And BDNF and all of that.
Yeah.
You just, tell our audience so that...
So when you exercise, you relieve the brain-derived neurotropic factor, which is so important to our cognition. And you can see it. Any person who is not working out, they can just try for a week of working out and try to do anything. In 1 week, you will see a difference.
Right.
most of us are living in a state of chronic cellular dehydration. That is cellular dehydration. We are drinking water and we are optimally hydrated. If there are now ways to measure it, 80% hydration होगा 90% लोगों का, and it is clearly linked to cancer, to hypertension, to diabetes. I'm not joking. It is really scientifically now. And what happens is thirst.
Your cellular signaling
So
would be greatly impaired if you are dehydrated.
100%.
And when you're saying hydration, I'm assuming you're also saying electrolytes.
obviously, there's not just drinking water; it's consuming the right food also.
Yeah.
Consuming the fruits and vegetables happen to hydrate.
That contain potassium.
So many, so true response. When it happens, when human blood has 80% water, when the concentration approximately drops to 70%, so there is relative hypernatremia. The sodium concentration in the blood rises. It signals the pituitary, it signals the hypothalamus in your brain to release anti-diuretic hormone, which tells the kidney, boss, pani ki kami ho rahi hai, we need to conserve water.
Right.
And all this happens, then baroreceptors and all those things happen. Then you have the feeling of thirst. So if you are feeling thirsty, you are cellularly hydrated at a gross level. And so number one, you have to drink water, and you should ever forget the feeling of thirst. Never feel thirsty in life. And the next common question which people ask me is how many liters to drink. There is no answer in terms of liters and glasses to this question. Everybody is personalized. Like I ran 21 kilometers yesterday, so my body will need more hydration. If I'm living in more AC room, my body will need less hydration. So it is so personalized on a day-to-day basis. I have exercised, how much, what foods I've eaten today, how much sleep I got yesterday, did I do my meditation or NSTR or not. Everything is crucial for your hydration levels. And the number two thing is the hydration gauge is inbuilt in us. Whenever you go and pass the urine, you have to see the urine color, and that has to be as clear, as transparent as water, or maybe just faintly yellow but never yellowish.
So when you're saying hydration, I would like to reiterate again, it would mean electrolytes and not just water.
Not just water.
Because that would lead to a host of other problems.
See,
Hyponatremia would be...
For a normal average person listening to a podcast like this,
Yeah.
it is not जो एक मिसकंसेप्शन है कि ज्यादा पानी पीने से खराब हो जाती किडनीज, है ना, ये बहुत लोग सोचते हैं, ऐसा नहीं होता है.
नहीं, but it's very hard to have ज़्यादा पानी also.
For a normal person to die of overhydration is not practically possible. So obviously there has to be nutrients and micronutrients and ideally supplements. So let's in the end, let's talk about supplements. There is a big debate about supplements, whether you should take supplements or you should not take supplements. But the issue began when we solved the big crisis of the 1950s, when we took care of the fast death causes, which were infections. Humans found out penicillin. That was the revolutionary changing for our medicine era. After that, the antibiotics, we ruled the antibiotics. Now we are masters of antibiotics, and we don't die of infections. COVID was an exception, but otherwise nobody is dying of infections these days. We are all dying of the chronic diseases. Why? Because overuse of antibiotics, and not just antibiotics. We clean this table also with antiseptic, antibacterial solution. We clean our mouth with 100% video mouthwash label. It kills 99.9% of the bacteria. There are so many good bacteria which are essential. We are killing those also.
All the other things, there's so many buildings, there's so many chemicals.
Yeah, it's not.
That's infiltrated the soil. So I don't even know what organic means anymore.
Very true. And even an organically grown avocado, called a superfood, is now has the nutrient quality just 10% when it used to have, if you compared an avocado nutrient quality 50 years back. So that's how much the nutrient quality has gone down of the soil. So packaged food is obviously not dependable, but even organically is not dependable. As you rightly said, there's nothing called organic today. And the supplement ka name question hota till how long? So ideally till lifelong. Ideally, you eat your food every day, you drink your food, you drink water every day, you go to sleep every day. So vitamin C and all these, vitamin B12.
When I speak to a lot of clients who are averse to the whole idea of having eggs and, protein, natural sources of protein, I mostly find them deficient in vitamin B12. And, if somebody has a, let's say, ethical or a religious reason, I totally understand.
That's okay.
In that context, of course, it's sentimental value. It's what your being is about. But coming up with an excuse that, I just don't want to, have it because it's not available, this, that, I think it's fixable.
What is your take on that? Is it
I
right?
think you can add a protein supplement for sure.
Yeah.
But the only problem is when I've tested, and that's one of the reasons why we do not collaborate with any protein brand as such. My friend Eklavya Juneja, he's a director at Pathkind, and he got a couple of tests done on some supplements and stuff. And I'm not going to name those supplements, but they didn't contain as much protein. There was 60-70% protein. And there was also steroids and traces of steroids in those protein supplements. So, when we speak so openly that yes, we should take supplements, etc., all of that, you'll see most of the protein companies are just packaging and marketing companies.
Yeah.
They're not manufacturing it on their own, and they themselves don't know what exactly is going in it, because everybody's got the licenses and all of that.
Very true.
And unfortunately, India is a great place, but in India, there are very few consequences of, giving misinformation,
And improper quality.
improper
products.
quality and all of that.
Know that FDA approved levels of safe lead, safe iron, safe cadmium. There is nothing called as safe levels. So vitamin D3K2, vitamin B12 in the right format, sublingual. Then protein if is essential for your body. Vitamin C is very, very essential, which ideally should be taken in 1 gram minimum per day,
Yeah.
not 500 mg or something like that.
Prevents a lot of diseases. It's a very powerful antioxidant.
Yeah.
Prevents a lot of free radical damage, lot of anti-aging,
So true.
etc. So yeah, 100%. I'm with you.
And
there.
what about omega-3 also, I think?
Omega-3, 100%. If you're able to get omega-3, which is
The right, again,
a good source,
again the same question.
In mercury.
Quality,
low mercury.
that's always there.
So yeah, I'm a big fan of omega-3 for sure.
View, then I'm again guessing. I'm also guessing. So the final answer is ideally to do a gut microbiome test, which is not practically possible to everybody, but we should at least give this information to the person whomsoever is willing should have the tools ready in front of them, whether he or she wants to do it or not.
Right. No, that's amazing. So would we definitely conclude on the fact that most diseases that you have dealt with in your years of practice, they could be prevented through good exercise, good nutrition, good sleep?
So the 5 pillars which I told.
Five pillars.
Number 1 was nutrition. Again, we talked a lot. Nutrition with we can keep on talking. And nutrition, again highlighting hydration is the part of nutrition.
Of course.
So nutrition, hydration is number 1. Number 2 is exercise in the right balance and with flexibility and with stability. Number 3 is sleep, very, very crucial. Number 4 is non-sleep depressed or blue mind, meditation, yoga, nidra, everything nails, daydreaming, as I mentioned, default brain network, everything nails down the same. And number 5, which I have also recently started understanding deeply and which you very nicely highlighted, is the emotional health or the psychological health.
Right.
These are the 5 pillars, and if you work on it, and then you can prevent everything. I think all diseases, cancers is just nothing to be worried about, but you need to be self-aware.
So having said that, it was amazing having you here.
Thank you.
Very insightful conversation I had with you. I love it when people have such ideas where I can have a conversation. So thank you so much for watching our podcast, and stay tuned for more expert advice from guys like Dr. Arpit Bansal and more to come. Thank you.